as symbols of national identity go, public healthcare's wallet-sized ID card is pretty prosaic. But when I recently asked you if public healthcare defines Canada, your answers were anything but. The question was prompted by a visit to Toronto by Margot Sanger-Katz, a health policy reporter in the Times' Washington bureau. She had tagged along with Senator Bernie Sanders, who took a field trip to look at Canada's healthcare system. As a visiting American, Ms. Sanger-Katz was particularly struck by one thing. Time and again, people in the healthcare system and patients used the word fairness when discussing it. The overwhelming consensus of Canada letter readers, at least based on your emails, was twofold. Despite its flaws and regional variations, public healthcare is generally a key to defining Canada. And for many of you, it reflects a more collective spirit lacking in the United States, particularly now. Though, of course, not everyone agreed. Many of your emails mentioned how the system owed its existence to Tommy Douglas, the Baptist minister who, as Premier of Saskatchewan, introduced the first provincial health care program in 1947. Mr. Douglas, as many of you also noted, was the father of the actress Shirley Douglas and grandfather of Kiefer Sutherland, who plays an accidental president of the United States in the television thriller Designated Survivor. Mr. Douglas may have pioneered public health care, but he never saw his dream of a socialist Canada realized. The party he once led, the New Democrats, has never held power federally. And a Liberal government made universal healthcare a national reality in 1966. Few, if any, politicians within the mainstream spectrum would dare suggest ending it today, although calls for reforming its services, which are delivered by the provinces, and its funding have become the perpetual motion machine of Canadian politics. Space doesn't allow me to include all of your responses, but here are some of the highlights, which have been condensed and edited for clarity. Defining values: it is all about fairness. Canadians believe that every citizen has a right to the same services and privileges as everyone else and the same responsibilities as every other citizen. The latter is less often expressed, but is part of the fabric of our society. We have worked very hard as a society to ameliorate or eliminate disparities as much as possible, across a vast landscape with a sparse population. Universal health care is one of those measures. Jane Mattei, Calgary, Alberta. Setting us apart, we do see our healthcare system as a defining feature of our society, but as with many of the things we see as integral to our own self-image, multiculturalism, bilingualism, peacekeeping, gun restrictions, the monarchy, we choose to identify with it mainly because it sets us apart from the USA. Remember, in the context of developed countries, the Canadian healthcare system is pretty unremarkable. It is the US that swims against the current. John Ringer, from Toronto, currently living in Britain. Diverging paths.